Good afternoon. Today I was wanting to talk to everyone about Botox. We think about Botox in the treatment of wrinkles in the glabella, or the middle portion of our eyebrow region, across the upper forehead, and then in the crow's foot area. That's the most common application, and we see, 10 to 15 patients a clinic to do that. We use 15 to 20 units here, 15 units here, and somewhere around 7.5 units per outer eye area. The cost is $11 a unit, but Botox has a lot of other applications, and so I thought it would be a benefit if we shared some of those. One is blepharospasm, and that is the person who has an eye that blinks involuntarily. You can control that. It lasts about 4 months at a time. Another one is people who have a big master muscle. That's the muscle that's used to chew and move our jawbone up and down. So if you have a prominent master, you can reduce the bulkiness of it, if you will, by injecting Botox into it. Again, lasts 4 months. Another application, gummy smile. You see some people that smile and you see too much of the gingiva or the pink portion of the gum above their teeth. You can inject for a gummy smile, usually about 10 units. So you're talking about $110 in order to get rid of a gummy smile for 4 months at a time. Another indication would be sweaty palms, hyperhidrosis or excess sweating of the forehead. And then actually, we've injected Botox into the armpits for hyperhidrosis or excess sweating there. Miradraw is another option for that, but prior to that, Botox had a big application. And then obviously the other thing's headaches. You can do it in areas across the face, the temporal region, even in the back of the neck for headaches. So lots of different applications. And to find out if you're a candidate, you can call Devin or Susan or Michaela here in the office, and they can bring you up to speed, tell you exactly how many units you need, etc. Thank you. So we got this cutie here today. Anyway, she's never had Botox before and was given consideration to it because even though she's very, very young, you see she has an extremely strong corrugator. So do that, your main scalp, okay? And relax. And see, even when she relaxes, she still has one of the 11s, okay? And so what we talked about was injecting Botox today into that area. And the idea is, one, preventative, but two, is curative for at least a 4-month period. So with that in mind, I'll let you give it a go. The nerve here and the nerve here, we stay inside of that and do your scowl again, okay? And we see that muscle activity, and we're gonna put a total of 20 units in. So here we go. 1, 2, 3, ouch. And then we'll go to the other side. Bow. Okay.
That did not hurt at all.
Excellent. Well, that's what we like to hear. And the other big thing is, from our standpoint, we want to minimize any risk of bruising. So we use these ice packs before. I think that helps diminish pain for the actual injection. And we use an obviously extremely small 30-gauge needle. And then ice after it, obviously, I think as well helps swelling. That way she can hop up, go right back to what she was doing, and not really having the evidence. Now, from my standpoint, what I'd like for you to do over the next 15 minutes when you think about it is make that scalp.
Okay.
And that'll increase your uptake, because ultimately what this is a protein that's going to bind to a receptor and block acetylcholine from doing its thing. Okay. And you'll see day 3, you really should be able to see the beginnings of the impact of it, and day 7 to get sorted to your final result.
Okay.
Okay.
It really, really did not hurt at all, and I'm like a weenie. And I was like, it didn't even hurt as bad as a flu shot. So I'm
great.
pleased.
So you're pleased.
Yeah.
Good. And we've sat here for probably a minute.
Mm-hmm.
And as you can see, you can look at her forehead, scalp, and there's no redness. Relax. No swelling. No bruising.
So the main scalp, your corrugators are pulling you in. That frontalis okay. Come here. There. here. And when you think about it, do that over the next 15 minutes. Increases your uptake. 3 days later, wrinkles gone.